welcome to the Midweek Wednesday edition of the Todd Veinotte Show. I'm Dan Alstrand. Glad you're able to spend some time with us as we get you off to the first, I guess, can we call it the first real work day of this week after all of the fun and frivolity that we've dealt with Mother Nature over the last couple of days. The first day back at school today. I saw some kids out on the sidewalks this morning waiting for the school bus. It's the first day at work for some of you who perhaps were working from home for the last couple of days or took some days off to deal with your children who didn't have school for a couple days here at HRC. Now, outside of Halifax, there are still some schools and some school districts or regional centers for education that have shuttered their schools today as the cleanup continues around the region. But here in HRM, it appears, and this is just based on my commute and what I can see out my windows, it appears to be business as usual around HRM as we get on with winter. We know, and it's almost ironic that we start talking about the next one even before this one is done, right? And the meteorologists, I watched CTV last night, and our meteorologist, Alistair Alders, watching this next nor'easter that's coming to the area now. Everybody being very careful, and rightfully so, I think, to warn that when it comes to these storms, we've been around for a long time, right? We know what happens with these things. If we start getting panicky 6 and 7 days out, then storm tracks change and intensities change, and the storm has to travel a long way before it gets here. But it looks like at this point it's going to be a Sunday, maybe into Monday event, and there could be double digits worth of snowfall with this system. We'll pass on any new information that we get on it as we get it. And, of course, Alistair will be joining us here on Friday for his regular conversation with me and with you, and he will bring us the very latest on this storm. But it looks like our shoveling isn't quite done yet. So get out there and enjoy it today because it's beautiful and it's sunny and it's starting to warm up a little bit. It's these low double digits are starting to move their way out. If you're going out and you need diesel fuel this morning, you're going to pay some more. The utility energy, the old UARB, the Energy Board, I think it's called now, using the interrupter clause last night to raise diesel prices by 7 cents a liter-ish. Gas prices did not change, but diesel did, and it's likely the result of the weather. We can put together pretty easily a case that with this big cold snap that's been right across the country and stretching as far as Tennessee and Texas in the United States, that the demand for diesel fuel for heat and for those associated things is on the rise. And, of course, when the price is looked at when it comes to what's going on with demand, that is what happens to the market. But if you need diesel fuel today, be prepared if you're heading to the pumps. 7 cents a liter increase by the interrupter clause. And don't forget, the Nova Scotia Energy Board will adjust gasoline prices again on Friday. So we'll keep our eye on that. Before we get to our first guest this morning, Regional Council yesterday, long debate on bike lanes. Go figure. And by the time everything was all said and done, they decided with a new staff report in hand to go with 2 of 3 recommendations to lower the price of the overall cost of these bike lanes by, $4.7 million. Interesting discussion, interesting debate about these lanes. It seems that there are 2 camps at council on this, and there have been 2 camps for a long period of time now, and nobody seems to be moving off their position. The mayor, after the debate yesterday, putting out a statement saying that he is now again asking city staff to go back to the bike lane issue and to look for cost alternatives that may move some of these lanes off of this gold-plated AAA system that everybody is is fetting. So that might be something that you want to talk about. We have some audio from yesterday's council meeting. We're going to play that during the open hour today. That, of course, is going to happen at noon. So make sure you stick around and stay by your radio. I look forward to your conversation. We move it to noon on Wednesdays because Dr. John Gillis will be here after 11 o'clock to answer your medical-related questions. And you don't have to go very far in your office or in your family to find somebody who's sick these days, right? This flu bug, I had it. Dr. Rob was telling me that he had it. It's moved its way through our radio station, and I would imagine at your places of work as well. And it's a tough one. I'm still kind of dealing with it, and I'm 4 weeks in. So, yeah, this is it's a tough bug. So we'll talk to Dr. John about that, and he'll answer all your medical-related questions. With all of the weather and all of the shoveling and all of that stuff that's going on, I think this next story kind of maybe got buried a little bit, pun intended, and I think it's an important one. And this is off of our website this morning. It reads, the Nova Scotia government says it disagrees with parts of the Auditor General's report calling on the province to be more transparent with the performance of its healthcare system. The report delivered on Tuesday, Auditor General Kim Adair says taxpayers can't properly determine whether major investments are paying off if they don't have the proper data. Her report looked at the province's $1.3 billion healthcare strategy announced in 2022, which promised regular updates on topics as access to primary and long-term care, the number of doctors and nurses in the province, and emergency wait times. Adair telling reporters the lack of regional breakdowns might mask what's happening in each health zone, so it's improved transparency. It's unfortunate that they have disagreed with that recommendation. Very pleased to welcome back to the show, I think this might be the first time for 2026, and that is independent MLA Elizabeth Smith McCrossin. Elizabeth, how are you?
I'm great. Good to be there. Good to be with you this morning.
Are you all shoveled out?
I'm actually traveling. My husband and I were out visiting our son. He's in the Navy in British Columbia, and so we're just traveling we're on our way back home. So we missed all the snow, but we've been getting reports from friends and family and my staff at the office.
Right. Beautiful Esquimalt, BC, I assume.
That's right. Exactly. Yeah. He wasn't able to be home at Christmas, so it was wonderful to be with my boy.
Right on, everybody. I can understand. I appreciate that, I'm sure. Elizabeth, tell me a little bit about your thoughts on this Auditor General's report, and I think more importantly, the government kind of pushing back on it.
Yeah, I think, this has kind of been the theme of this government, and there's a lot of politics at play. Honestly, when I actually watched the press conference on Monday with the Minister of Health about the changes to the registry, the change of the name and the semantics and the logistics of it. And I thought it was kind of strange that so much attention was being put on sort of the rebranding of this when what people, the constituents that I represent and the people of Nova Scotia, what they want are a doctor. They don't really care how the inner workings, I guess, of the department. So I was kind of surprised. And then, of course, yesterday we saw the Auditor General's press conference and the release of her 13 recommendations and letting us know that the government actually denied or refused to take on 3 of them, which is what we've been seeing. And I was doing some studying and reading last night. It's not normal for a government to not accept the Auditor General's recommendations. The Auditor General is neutral. She's like Switzerland. Her and her office, they're there to make sure that taxpayers' money is being spent wisely and that there's transparency and accountability. They have a very important job. And in fact, this government, when I was with this government, back a few years ago, we had put forth a bill. I had done it as health critic with the support for a health auditor general, a very specific auditor general to look at the accounting and to improve transparency and accountability for healthcare spending in the province. And it was one of the things that the Houston government did as soon as they got into power, is they didn't add an auditor general, but they did increase the responsibilities to the Auditor General and made it clear that they wanted more of a focus on this. But even though they've done that, they're not taking the recommendations of the Auditor General. And healthcare is the number one issue what I'm hearing from people. It's very important.
It's very interesting, and I'm just trying to recollect my time dealing with Auditor General reports, and I'm struggling to find an instance where a government just didn't take all of the recommendations.
It's not normal. My experience since 2017 is that governments respect the Office of the Auditor General, and they take their recommendations, and the departments do the work to put them into place. Now, there's a lot of politics at play here. There's not a doubt in my mind, and the Auditor General was fairly critical of the way the government have been managing this Native Family Practice Registry. And they, the Auditor General's office were saying that the numbers that we're seeing aren't necessarily truly representative of the number of people that need a family doctor. Now, my opinion is that what I would like to see the government doing is actually talking about what are they doing for recruitment and retention of physicians and nurse practitioners in this province. I'm hearing rumors that the money's dried up, that there's no spending now on recruitment for physicians. If that's true, I think the people of Nova Scotia deserve to know that. If it's not true, that's good. Let us know that and show us the proof. Because, I'm hearing from people every day that don't have a family doctor or a nurse practitioner, and they can't get access to care. Just recently, I'll give you just an example, someone that had a breast lump, and you can't book a mammogram in this province if you have a lump. If you don't have any symptoms, you can book a mammogram. But if you actually have a problem and don't have a family doctor or nurse practitioner, you can't book a mammogram unless you go to the emergency department. So there's a lot of people listening to this show this morning and out there in Nova Scotia that don't have basic access to primary care, and that's a major problem. And what I'm seeing as a nurse and as an MLA is it's leading to delay in diagnosis and early mortality, and that's not okay.
Elizabeth, we had Minister Thompson on the show yesterday, and we were talking about the new dashboard list, whatever you want to call it, and she seemed to indicate that the significant drop in the numbers from well over 100,000 to whatever it is now, 66,000, was essentially an accounting error. It was double people on the list, and then I asked her, I said, well, over that period, did we see an increase in doctors, or is this just an accounting number? And she sent me some data that said from March until December of 2025, which I guess was the last fiscal year, that we saw a net gain of 63 family physicians. That seems like a rather large number, and doesn't kind of mix with what the minister told us yesterday.
Right, exactly. And sometimes you gotta ask other questions too, like how many of those physicians are actually practicing in family medicine? For example, right. Some of the new family medicine residents are staying in Nova Scotia, but they're not opening family practices. They're going to work as a hospitalist or in a other type of clinic, or in the emerge. And while those are important, we need to shore up and get people a family doctor or a nurse practitioner. When you can't get that basic access to care for early detection of disease, for chronic management of disease, then you're just actually putting more of a burden on the ERs and on our hospitals. And we can prevent that if we have a strong primary care system here in Nova Scotia. And it is possible. It's, when I was looking at the numbers, I did a new 12-point healthcare truth and action plan, I called it, over Christmas and New Year's. That was that was what I did with my Christmas holiday. I can't help myself. I try to relax. But in my plan, I did some analysis, and point number 6 is end the 2-tier system here in Nova Scotia, because the 2-tier are people with a family doctor or nurse practitioner and those without. And, when we look at, say, if there is really 66,000 people, that's that could easily be fixed with some real hard work. So I'm encouraging the government to create a collaborative team, work with the existing nurse practitioners and family physicians to see if there's any ability for them to take on. For example, if every doctor that's currently practicing, there's 1,300, a nurse practitioner took on, that's only 44 extra patients each. Now, that may be too much, but maybe they could be working with some family doctors that don't currently have a family practice nurse or nurse practitioner. If they added family practice nurses, they could potentially add 400 patients to each practice as well, because when there's a family practice nurse, the practices have an ability to see a lot more patients. So there's things that could be done. We could have that list down to zero. I was really disappointed to hear the minister say that the list will never be zero.
Yeah, she said it again yesterday.
Why not?
Yep.
Why not? Why should every Nova Scotian not have access to primary care? That the goal should be that every Nova Scotian has access to primary care. And for the minister to say that's not possible, I think it's time for the minister to sit back and take a look at, what's been happening since they got into office. They need some rejuvenation. I looked at their Action for Health plan. It really hasn't been updated that much since they first got into office. And again, I'm hearing from Nova Scotians every day. Just last night when I was going through my emails, 2 more people last night contacted me with devastating experiences. And I'm hearing from people every single day from around the province. And it's not okay. We need to be doing more. And there are actions that can be done that get people the care that they need. And, when we hear that not everyone will get attached, that's not the right thing we should be hearing from our government.
Elizabeth, appreciate the time. Safe travels.
All right. Take care. Have a good day.
That is independent MLA Elizabeth Smith McCrossin. When we come back, this year's African Heritage Month theme in Nova Scotia is Strength in Unity, moving forward with purpose, prosperity, power, and progress. A conversation with Twila Grosse when we come back. You are listening to the Todd Veinotte Show. I'm Dan Alstrand. We are back in minutes. Hard to believe that we're almost at the end of January. By the end of the weekend, we'll be flipping the calendar into a new month. And of course, February in Nova Scotia is African Heritage Month. And this year's theme is Strength and Unity, moving forward with purpose, prosperity, power, and progress. And the Minister of African Nova Scotian Affairs says that is a call to action. We're very pleased to welcome to the program the Minister of African Nova Scotian Affairs. That's Twila Grosse. Twila, how are you?
I'm doing well, and how are you today, Dan?
I am well. Are you shoveled out?
I'm shoveled out. Yes, I am. Thank you so much.
I guess the first question is why is the observation of African Heritage Month in Nova Scotia so important?
Well, African Heritage Month is important because it's a time to recognize the legacy, the contributions, and the experience of African Nova Scotians and people of African descent. What I love about it is that it provides space for learning, for celebration, and also for reflection, which is important. And it helps the understanding and connection across communities across this province.
You said in the release with the flag raising of the event that this is a call to action. Can you explain that?
Well, this year's theme, what it does, it speaks of the strength that comes from collective action, working together, and also a shared purpose. And so, therefore, there is strength in unity. There's strength in terms of coming together, in working together, in building. The theme, why I say it's a call to action, because it not only speaks to what we celebrate, but what is needed. and what we must choose as we move forward in continuing, to build this province up, and also recognizing the history of African Nova Scotians, which is part of the history of this province.
What is needed for African Nova Scotians to move forward, Twila?
Well, what's needed for African Nova Scotians to move forward is, support from, ongoing, continuing support from governments. Needed to move forward is, building up our communities. There's a lot that have been done. We've worked hard in terms of working together, but those are some of the things that are needed. Some of those things are in place. Some of those things are in motion. It's not going to happen overnight, but some things are in fact happening.
Obviously, over the last few years, there's been a more of a focus on the African Nova Scotian community here in Nova Scotia. Has progress been made over the last 2 years?
Yes, progress has been made. Sometimes definitely meaningful progress. Like I would say progress in areas of cultural preservation, areas of youth leadership and community development, which is, very important. And you know what? My department and African Nova Scotian Affairs, which is an office of the government, we've worked alongside, different families and various community initiatives. One of the key initiatives is like the Land Title Initiative, which supports, generational stability. And there's always work to do, but there's progress that's being made step by step.
Minister, there's tons of events that are planned over the month of February to celebrate African Heritage Month. What's the best way if somebody wants to take part to find out where these are happening?
One of the best things to do is I would suggest that folks go to the Black Cultural Center website. And there's the button on there that says calendar of events. And if you click on that, you can see what's happening. But there's events all from one end of this province to another. There's events, community events. There's, opportunities, learning. There's community gatherings. There's, celebrations. A lot of events, a lot of things happening this month.
Mr. Grosse, I appreciate your time this morning.
Well, I certainly appreciate your time. Thank you. And just want to simply end by saying that I trust that folks will take the opportunity to get involved in some of the events, more awareness, more understanding of the African Nova Scotian and people of African descent journey and history in this province. Thank you so much.
You're very welcome. Have a great day.
You too.
That is the Minister of African Nova Scotian Affairs in Nova Scotia. That is Twila Grosse. When we come back, the province announcing yesterday that it is improving half of the 300 permits that it has currently in its arsenal as part of its commitment to make government services faster, simpler, and more efficient. A conversation with the Minister of Service Efficiency. That's Timothy Halman. When we return, you're listening to The Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes. Welcome back to the Todd Veinotte Show. I'm Dan Alstrand. I don't think you have to go very far in the business community to ask a business owner or a company or a corporation their frustrations dealing with red tape and dealing with government and dealing with permits and the cost and the time that's associated with them. I think that if we could ever get business owners to agree on one thing, that is something that they all don't necessarily think is effective and is expedient, to say the least. Well, yesterday the province announced that its Fewer Permits Faster program that they launched last year has returned its first comprehensive review of the permitting system in Nova Scotia, and they're saying that about half of the 300 permits that the province issues have been improved under this system. Very pleased to welcome to the program today to tell us a little bit more about this, the Minister of Service Efficiency here in Nova Scotia. That's Tim Halman. Tim, how are you?
Doing just great, Dan. How are you doing?
You all shoveled out?
All shoveled out. I got 4 teenagers at home, and you want to talk about service efficiency, we put them to work, and we had that driveway cleared up pretty quick.
There you go. Wow, nice to hear that. It's nice to have that labor around the house, isn't it?
Absolutely, especially 4 teenagers. No problem putting them to work.
Lots of energy. Minister Halman, I guess the broad-reaching question on this is this has been just over, or maybe close to a year in review here. Was this a response to concerns raised by business and industry that the permitting system here in Nova Scotia was just way too long and too expensive?
This has been a long-standing problem in Nova Scotia, and certainly the Houston government, our government, we have a laser focus on modernizing all our regulations and rules. We're at a point now where this is coming out of complete necessity. The global uncertainty because of the Trump tariffs is forcing all levels of government, specifically the Nova Scotia government, to cut red tape. Cutting red tape doesn't mean we're cutting corners. We want to remove the unnecessary rules so that we can focus on the essential, so that we can build hospitals faster, so that we can get housing faster, so that we can build up our economy. And it's starting to pay dividends. The past year that we've done this fewer permits faster, just today, the Canadian Federation of Independent Business gave Nova Scotia the grade of A. We are ranked second in Canada for service efficiency. So this is going to help us build up our economy, and certainly we have actively been listening to businesses, not-for-profits, the residents of this beautiful province. How can we make regulations more effective and clear? And we're definitely on a really good path.
The release yesterday, Minister said that the province will eliminate permits associated with low-risk activities. Can you give me some examples of those?
Yeah. So, for example, we used to regulate the foraging of berries. I'm curious why that came about decades ago. So we've eliminated that permit. Nova Scotians care deeply about the environment. So if you want to do a litter cleanup along the highway, you used to have to apply for a permit from Public Works. We've eliminated that. So you just need to do a notification. Call your local Public Works office to let them know you're going to do a cleanup along the highway. So we're trying to make residents' interaction with government more effective and clear. Along with that, making our regulatory rules clear and effective. Like you're seeing the results. Like we were able to approve the first gold mine in a decade just a few months ago. And we were able to achieve that because of the regulatory reforms. And that gold mine is going to add billions to our prosperity, and it's going to add hundreds of good-paying jobs. So, look, in a time where we know we have to focus on the economy, this lever of service efficiency, cutting red tape, is absolutely key to build up the economy and to get the services Nova Scotians need: more hospitals, but more health care, better education, all those things.
Minister Halman, you said that Nova Scotians care deeply about the environment. By fast-tracking things like gold mine permitting, are we going to fast-track our way into a environmental disaster?
Not at all. Look, cutting red tape does not mean we're cutting corners. Nova Scotia continues to have a very strong environmental regulatory framework. We have 10 regional offices, the Department of Environment throughout Nova Scotia, that monitors the strict terms and conditions attached to large industry to operate. So just because we're making rules clearer, because we're modernizing, updating rules that haven't been changed since the 80s or 90s, doesn't mean we're being reckless. It means we're being smart. It means we're modernizing. It means, when we say Nova Scotia is open for business, companies can come here with the assurance that we have strong environmental, safety, human health standards, but a process that's clear. You're not going to get inundated with a bunch of gobbledygook. We're going to use clear, precise language to explain to proponents, how our regulatory systems work so that you can get to a yes or a no as quickly as possible.
You mentioned in the release yesterday that you're streaming the application process. I think we understand that part. And then the scary word, restructuring fees. Are you going to eliminate fees for some and shuffle those onto others, or what does that look like?
So if you look at our regulatory changes for industry, we've modernized the environmental assessment process so that most projects are what we call a Class 1 environmental assessment, the fastest process in the country, 50 days that you'll get a decision. We've modernized the industrial approval process. We've created a specialized team of regulators for large industries called the LIFT team, the Large Industrial Files team. I call these folks like the Navy SEALs of regulators. Like they are precise. And so we've done a lot of innovation, and certainly in terms of fees and things of that nature, we're always reviewing, is that fee an obstacle? Is it getting in the way of sustainable growth and development? So look, I can tell you, the culture of red tape reduction, the culture of service efficiency is very much infused across all government departments in the Nova Scotia government, and we're just getting started, right? The grade of A that we just got from the CFIB, Canadian Federation of Independent Business, is fuel. Like, we're just going to go faster in this year, in 2026, to get more modernization, and it's coming out of necessity and because of the global uncertainties, the economic uncertainties. But we're in a good place, and we're going to keep going.
On the fiscal end of things, Minister, we know that the province is facing a $1.6 billion deficit. We know that y'all are going to be back in session here at the end of February with the legislature resuming. Any concern that eliminating these fees and so on and so forth, I think the number was $21.5 million, that's going to hit you on the bottom line in the coffers?
Not at all. This is the elimination of those fees. It's about growing the better paying jobs. It's about making sure Nova Scotia, that we operate as effectively and efficiently as possible. For example, if you had to apply for a permit every year, in some cases, those permits you only have to apply every 4 or 5 years, and residents will save money as a result of that, more money in their pockets. So we have a very, very ambitious service efficiency approach. And look, this is about fixing like the foundation of government and making sure residents have the best interaction with their government. And not only that, making sure business, not-for-profits, they're able to operate vis-a-vis the government as effectively as possible.
And this might not be your purview, Minister, but I'm going to ask it anyway. We're talking about fees for permits for businesses. What about fees for permits for Nova Scotians, like license stickers and inspections and those kind of things? Are you reviewing that?
We're looking in 2026. We're always looking at all things that government does. There's always continuous, plans for improvement. As I indicated, there's very much a culture in the government of Nova Scotia that we welcome the suggestions from residents. We welcome suggestions from business and not-for-profits. We welcome the suggestions from our government departments in terms of how we can improve and get better. And that's very much an attitude that we have. And that attitude's paying dividends. We're recognized, as a leader on red tape reduction. So much so the Canadian Federation of Independent Business just said to the new government in Newfoundland, like, if you want to get focused on red tape reduction, have a look at what Nova Scotia is doing. And I know the Premier of Newfoundland will be here in Nova Scotia at the beginning of February, and I'll certainly have a chat with the Newfoundland Premier about that.
Minister Halman, appreciate your time, sir.
Thank you. All the best to you and your listeners.
That is Tim Halman joining us on the program, the Minister of Service Efficiency here in Nova Scotia. Time for us to take another break here on the program. On the other side, we're going to continue the show with a conversation with the health critic for the Nova Scotia NDP, Rod Wilson. We're going to continue to look at this number that has come out from the province and this new improved dashboard for us to see who and how many are on the waiting for a doctor list. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes. All right, welcome back to the Todd Veinotte Show. I'm Dan Alstrand as we roll along here on a midweek Wednesday edition of the program. We're continuing our look at the announcement this week that there are still, I think, 66,000 is the number. We're going to get the actual dashboard. I think the minister said in April, but as I understand it, about 66,000 people still on the waiting for a family doctor list here in the province. That, of course, is down significantly from the well over 100,000 that we saw before. But if you were listening to our conversation with the minister yesterday, Michelle Thompson saying that they did this comprehensive review on the thing and there was some accounting problems and some duplication and people that were on the list that shouldn't have been there, that put their name on the list because they thought their family doctor was retiring. And then I asked the minister if that list was ever going to get to zero, and she again said that she didn't think it ever would, which has certainly raised an eyebrow with me and with others. And I would imagine our next guest also has a raised eyebrow with regards to that. Please welcome to the show today for some perspective on this, the health critic for the Nova Scotia New Democrats. It's Rod Wilson. Rod, how are you?
I'm good. Thanks for having me.
Never going to get to zero. That's what the minister said.
Interesting comments. What's missing in that is, well, what is the goal? What is the goal for this year? What is the goal for next year? What is the goal for 5 years? Other jurisdictions have set very clear and defined goals. So what is the Nova Scotia goal?
Yeah, it's a fair question. And is it a percentage? Is it a number? Is it a target? We don't know.
And that's what I've been asking as the health critic and also as a family doc is, what is the goal? And I look at Ontario. I'm no fan of Doug Ford. Jane Philpott, who's an amazing leader in healthcare, was brought in. Ontario has set very clear goals. Like, I think they have 6 million people without family doctors. They have set goals that in this year we're going to, I think they've set 3 million for the first year. I'm not going
sure.
And put that out to the public, which to me is kind of bold and leadership. It's like, this is our goal, this is what we're going to shoot for, and this is how we do it, and hold us accountable for that. We're not seeing any of that in Nova Scotia. We're just getting reported numbers which are questionable. We don't see the bold, brave goal leadership, and that's something what the Auditor General also reported on this week, that there was no goals to benchmark against.
And the government pushed back on the Auditor General, saying they weren't going to enforce 3 of her recommendations.
Which is alarming. The Auditor General is a really, like any auditor in any type of sector, is a really independent, valuable, how do you do better? How can we do better? And so for any organization to say we're not going to follow the Auditor General, there has to be a really, I think, a very compelling reason why you wouldn't do that. And we didn't hear any compelling reasons why the advice that could make to shoot for better is not being followed.
In your opinion, Rod, is it possible to get to zero? Is there enough infrastructure there for us to get everybody a family doctor?
You hit a nail on the head there, that the infrastructure, right? And so that's what we have to determine is, what is the infrastructure that we need and what is the goal? And so I was just looking at the College of Physician Surgeons numbers that show that there are 678 doctors over the age of 60. This is 2024 data. And so that raises the question, well, what type of care do they provide? Because a lot of family doctors are in your office, in Emerge, doing inpatients. And so if we want doctors for office, but we know that they're doing other things, what's the number that we need to provide primary care? And then the other aspect of that is, how does primary care of the future look like? We have home health. Like I worked in a community health center where the North End Community Health Center, where people had multiple providers and we collaborated. So people could be seen by the nurse practitioner. People could also be seen by their mental health specialist. And then we met and we shared care to provide that. So what's missing again in this picture is what does future care look like, and what's the infrastructure that we need? How many mental health workers? How many nurses? And I've been asking for a year, what is the plan, not only for primary care, but also for emergency services?
Nova Scotia is competing against the world for physician recruitment, right? There's only a finite number of doctors that graduate or are available every year, and just about every jurisdiction, at least in Canada, are fighting over them.
Absolutely. And we used to be a very attractive place. We still are physically quite an attractive place. But we know that with the cost of living in Nova Scotia being one of the highest in the country, that's a mitigating factor for recruitment. For example, last year when I was knocking on doors, and it kind of really was sad and disappointing. I met a physician who was about to graduate, had a family, several kids, had a mortgage, and with a double income, 3 kids, said, I can't afford to live in Halifax, and they were moving to rural Ontario. I also spoke with a physician that's moving to Calgary because they can't afford to buy a house in Halifax. So first of all, we definitely need physicians. We need to think about how we're using our physicians to the best of our ability, the right person, the right work time. But the cost of living and affordability is a huge impact on recruitment and retention. And even the lack of housing. Like I do local in Canso, there's no place a physician wanted to move there to live. So it needs to be look at a big picture of not only how are we going to recruit, but how are we going to retain? And certainly the lack of housing and the cost of living is a negative factor for recruitment in Nova Scotia.
Rod, we're almost out of time, and you're very plugged into the physician community. Are they burning out? I hear doctors are just working insane amount of hours.
Absolutely. I get a call every month saying, can you come and help? I know that they're short 20 FTEs in Cape Breton, and the doctors there are burning out. Rural doctors are burning out. Emerge doctors are burning out because there's no light at the end of the tunnel. Physicians and nurses just tend to pick up the slack and fill in the holes when they can. So 5 years into this government, physicians, it's this moral injury of trying to do your best but not having the resources, both colleagues and others, to do it. And so besides the burnout, it's also the moral injury of I'm not providing the best care I really want to or used to be able to do.
Rod, appreciate your time.
Anytime. Thank you.
That is Rod Wilson. He is the health critic for the NDP. We're getting set to take our first break here. We're taking the news break here on the program. On the other side of it, it's time to talk to our physician, and we'll ask him if he's burning out, because we know that Dr. John Gillis works in the ER over at Dartmouth General, but still takes time out of his weekly endeavors to join us here for a bit of a shorter session today, because we just got word that Bank of Canada has held its key interest rate steady at 2.25%. So it doesn't look like you're going to see any reduction in interest rates. Well, you're not going to see any reduction in interest rates for the next quarter here in Canada. And when we have a Bank of Canada announcement, of course, we go to our mortgage guru. That is Clinton Wilkins. He's going to join us around 11:45 today to tell us a little bit about this and what it means for your mortgage, if you have a fixed, if you have a variable, if maybe you're looking at buying a house this winter or coming into the spring. Clinton Wilkins will join us around 11:45, but we will take 45 minutes worth of calls with Dr. John Gillis. If you have a health question, if you have something that maybe you want to have an opinion on, a second opinion on, maybe you have this crazy flu that's going around that's weeks upon weeks of not feeling well, and you're looking to see if antibiotics perhaps are for you, this is an opportunity to get some free advice on a Wednesday. Dr. John Gillis and House Calls will be next, right after the update. You're listening to the Todd Veinotte Show. I'm Dan Alstrand. We're back in minutes. This is the Todd Veinotte Show. I'm Dan Alstrand. As we get you off and running on a Wednesday here, as I mentioned off the top of the program, it appears that things are returning, if they have not yet returned to normal. As I look out over Robie Street, and it was pretty busy there for the last hour, but it appears to have lightened up a little bit as everybody gets off to where they were going. I saw some kids struggling through snowbanks this morning, getting on to the school bus on my commute in, and my commute was as busy as it ever is busy, and it was almost double what it was the day before. So it appears that everybody's off and back onto the work routine after a couple days of shoveling and snow days for the kids who, as I had mentioned yesterday, I thought that it was going to be a toboggan day for many children yesterday, and it certainly was. Drove by a couple of tobogganing locations here, and they were busy. The kids were having some fun. It is now time for house calls. The telephone lines are open, folks. 902-405-6000 or 1-877-801-8255. If you have a question, a concern, a query, here's an opportunity to get in front of a doctor and get some advice. Again, that number is 902-405-6000 or 1-877-801-8255. And we welcome back Dr. John Gillis to the show. Dr. John, how are you?
Doing very well. Had a bit of a break.
Yeah, had a couple of weeks off and spent the first one dealing with a chest infection and a cold. So I'm part of the flu that's going around.
You have to spend 8 hours in the ER, or did you
No.
man flu it at home?
I man flued it at home, and maybe after having conversations with others, maybe I should have. It's still kind of lingering around. This doesn't leave easy, does it?
No, whatever's going around. I've got a friend who's been kind of down and out for almost 2 weeks.
Yeah, it's ugly. It's right in your chest.
Yeah, no, it's legit, and people are struggling to ditch it for sure.
I imagine.
You're on the mend.
Yeah, thank you. And I imagine you're seeing a lot of it at the ER.
Indeed, we are.
It's. I wonder if it's the same flu bug that has infected our beloved Toronto Maple Leafs. The coach kind of threw up his hands last night, didn't he?
Well, it's ridiculous. I was there on Sunday, and it was like watching the Mooseheads play a Pee Wee A team. Like they're just standing around. People are blaming the goaltender, but he's like just under siege, and they're just getting giveaways, and I don't know. Last night was terrible. I shut it off. Couldn't even watch it.
Yeah, I went. They
were on a good run.
I switched it to curling because it was more interesting to watch. 902-405-6000, 1-877-801-8255. He is Dr. John Gillis. He's here to answer your questions. Dr. John, and I don't know if you were listening before the break, we had a conversation with the NDP at Nova Scotia's health critic, Rod Wilson, who works in the medical community outside of his political job. And we're talking about physician recruitment. We were talking about doctor lists and that number. He had mentioned that he's getting contacted by colleagues that are starting to get burned out. Is that what you're hearing from your colleagues, Dr. John? Are you burning out?
Yeah, people are frustrated. They are, and we have all sorts of issues. The ER staff are frustrated because they're overloaded. The place is stuffed. Everyone's in the hallway. Like, you get desensitized to it. And, my daughter ended up having an appendix over just after New Year's, and was treated at the IWK and received wonderful care. Unfortunately, she had to stay in for a few days. But just the difference between the adult ER and the IWK, it's like, I hate to use the analogy because it's not war. Nothing's like war, and our veterans and people who have truly faced this suffering, but it's absolute chaos in the adult ERs versus the order and the neatness and the relative peace of the pediatric ER. And I just think we've become utterly desensitized to it. I came in yesterday and there's 9 ambulances in the hall. Every every bed is full, every chair is full, there's nowhere to see anybody, and we're desensitized to it. We do our best, and staff do their best and carry on, but it's not a great situation. And the trickle down is onto everybody in those places. Family docs are under stress; they can't get stuff done. It's frustrating, and in addition to frustrating, risk goes up when you're working under duress, hours behind, with nowhere to properly assess people. And there are frankly people that are later in their career that are having serious conversations and serious thoughts about moving on to things that are less difficult, less stressful. And again, we start losing senior people who, not always, but who tend to be perhaps more efficient and based on experience and know-how and just used to processes. Then we put another strain on our system, and don't want that. But it's certainly something that's real.
John, is the differences between the adult ER and the pediatric ER, is it capacity, or do they have a different system? Why is there such a difference?
It's hard to say, and I just want to be clear. It's not. I'm not suggesting for a minute that they're not busy.
Right.
They are. They work very hard, and they do a fantastic job there. But just the dynamic of the place. You just didn't feel like it was about to fall apart at any minute. There weren't people in every hallway. There wasn't chaos. There wasn't noise. There wasn't. I think part of it is the nature of pediatrics, is that it's designed to be, a different process. I don't want to say slower, but with kids, you take your time and you create a different process, and I think that's implicit in how it's been designed. And perhaps just the strain on that our aging population has created hasn't quite popped through there. But again, I don't want to speak for the work they're doing. They're doing great work. I just noticed a real difference between the two. Just striking, having been with my daughter to Dartmouth, where I work, and the staff there were amazing to help her out and get her process started, as they always are. But just the pure chaos of the place every single day, versus what we saw at the IWK was striking to me.
John, the solution, at least from the political end of things, is to recruit more doctors, more nurse practitioners. But in our last conversation before the break, I said, well, Nova Scotia is competing against all of Canada and many jurisdictions around the world. How's that pipeline? Are you seeing new docs come in?
Yeah, look, we've talked about this before. We are. We're seeing new docs come in through our current pathways. We're seeing new NPs come through. We're seeing nurses and medics doing more in the system. We're seeing docs come in from overseas, and look, that is helpful. The missing piece has been the demographics over the past number of years, and you've heard me say this before.
Right.
We used to have docs that work too many hours, and that wasn't a good thing, and we've changed our demographics so we have people that are more lifestyle balanced and having families and doing things they should be doing. By all means, what happened is we cut the number of doctors to begin with, and then the average new family practice is nowhere close to what the old one is, so you need 2 docs to replace 1. And again, you've heard me say somebody thought it was a fantastic idea to put everybody on salary at some point with no accountability for production. And the extremes are no good. If people are just being paid with no accountability for production, that doesn't work. If people are just working 100 miles an hour so they can get paid for every task and not doing a good job, that doesn't work either. But the truth is somewhere in the middle. But what we did is create a perfect storm of cutting production of docs a number of years ago, not planning for a demographic shift, which was necessary but needed planning to account for it, and then coming up with whatever genius decided to put everybody on salary and cut our productivity. So these are the perfect storms. And if you bringing in more people is helpful, but what are they doing? And if there are roadblocks to how people bill, how I can't work with an NP and have them bill with me or under me because the system doesn't allow it.
Right.
There's a recent pilot project with doing something similar with physician assistants in the city, and it's kind of ground to a halt because of, again, billing issues, because ultimately, we'll throw money at massive projects, but when it comes to projects and systems that could get individuals seeing more people, for some reason people are afraid to pay the individuals, even though they don't mind throwing a big chunk of money at a project or at infrastructure. But if you want work done, sometimes you have to pay for it, and that's one of our biggest impediments, in this current dynamic, in this current system.
902-405-6000, 1-877-801-8255. Dr. John is here to answer your questions. Again, 902-405-6000, 1-877-801-8255. We're going to take a break. We're back in minutes. Welcome back. House calls underway. Dr. John Gillis is here, and he's here to answer your questions. The telephone lines are open, folks. 902-405-6000, 1-877-801-8255. Dr. John, let us go to the phone lines, and we welcome Julie to the program. Julie, how are you?
Fine, thanks.
Your question, please.
Yeah. Yes, I recently, I'm on a controlled drug, and recently they told me it wasn't available, had to go on the generic. And I was just wondering, what's the difference between the two?
What's the drug?
Vyvanse.
Well, really the difference is one was probably originally produced by the company that developed it and was copyrighted. When patented, when the patents wear out, they get made in generic form. For the most part, there's no difference. They have to be tested and made sure that they're of the same quality and to Health Canada standards. That's the case most of the times. Every now and again, I run into somebody who, that generic doesn't agree with them. That's sometimes because of what's in the binder or how the pill is made. That's pretty rare. The main reason for doing so is generics are much cheaper than name brands, and depending on an individual's drug coverage or whether it's pharmacare or what have you, they often, I would say usually default to generics if all other things are equal.
Okay, thanks.
Thanks, Julie. Appreciate it. 902-405-6000, 1-877-801-8255 is generics and brand names. That's been around for forever, right?
Oh yeah, it's not new. It's just with cost control where people's plans change or they're going on pharmacare or some people aren't used to it. And again, most of the time the drugs are the same. It's not very often you notice a difference. That's usually the reason why. It usually comes down to money.
902-405-6000 or 1-877-801-8255. Back to the phone lines and welcome Tony to the show. Tony, how are you?
I'm well, sir. Good day, gentlemen. My question has to do with AI and medicine, not so much as in diagnosis, but there was an article on the CBC website over the weekend where the doctors in Ontario, I think, were trying this out and using AI to help them or assist them in writing their reports after seeing a patient. And the idea was it'd be saving them time and be more accurate and all kinds of stuff like that. Is the doctor aware of anything like that in this province, or are they doing this here? Over?
Yeah, I mean, you're seeing that being used. I mean, there's apps available now where you can, use AI to, dictate your notes, or it will. There are some programs that will even listen to a conversation you're having and summarize it. I mean, these aren't brand new. Nova Scotia is moving to a new one patient, one record system in the emergency rooms. I believe it's actually at the IWK already, and I think it's coming to the other soon. So, I mean, I think there's some technology in there to streamline things. I certainly look forward to that because I write like a 3-year-old who's been taught hieroglyphs. My writing is terrible, but in my office I type everything and I type quite well. So yes, the short answer is yes. I think we'll see a continued evolution of that. I think, they are always trying to balance confidentiality and privacy. There's, as I alluded to earlier, I think there's still a reticence to innovate forbid we pay somebody 10% more. So it's sometimes this is the type of logic we're dealing with here as we try to bring these things in. But you'll see them. I mean, we didn't have any sort of electronic records widespread use 10 years. Now they're sort of the standard in the physician's offices and in the ER as well. But we're seeing even an evolution of that where we're hopefully not writing anymore in P-type. So, I hope it continues in an effective way, but I hope people also realize that efficiency is important, and one of the ways to solve our backups and wait lists is efficiency and to pay for it.
Good question, Tony. Appreciate it. John, with this one patient one record system, is that going to make your job as an ER doctor easier because you'll have quicker access to records?
Yeah, I think eventually. I think one of the biggest things is charting, and once we get used to it, the idea is to put all the information in one place in the charting and not going back to manually sign a chart you forgot to sign 6 months ago and try and remember something that you did 6 months ago. That's fairly uncommon, but still it happens, and if you can do it all in real time. In my office, I sign off all my records as I go. I write the note, I say what I did, billing, notes, referral, and it gets saved in real time, and nobody has to go back to it. So that should be the goal. And like I said, we're getting there. Good efforts are being made by the health authority to get this thing done, and it takes time.
Could you ever see a world where AI would be used for more than record keeping? That would be perhaps an assistant to a doctor, or is that just an ethical nightmare?
Say that again, sorry?
Could you ever see a time where artificial intelligence would be used other than record keeping to help with a diagnosis, or does that create problems with ethics?
No, I don't think so, as long as the portals are secure. I think we're already seeing that now. You can find that online now. There's virtual services that start with that. There are, all sorts of AI portals and things online that will, whether it's accurate or not, that's the question. But you type in your symptoms, they'll give you a string of possibilities. Now, will that lead to, you go to a portal, you arrive, instead of calling 811, do you go to an AI portal and say, I've had a headache for 3 days, and here's what's happened, and then it sort of gives you a pathway and pushes that to, the person who will be dealing with the next step. One of the problems with 811 right now is people call and then they come to see us, but there's no connection between the two. All you get is 811 told me to come here. You don't know what was said, so you're basically starting from scratch.
Right.
There's no connectivity between the two. And if AI, if people come into the ER and they start their process, with their, one of the things that we try to do when we can is, if you come in, and you're coughing and have a fever and there's a high chance you have a chest infection or pneumonia, let's get that ordered right away, so that by the time you have a place or someone's ready to see you, that the data point is there. But what often happens is you'll come in and then someone will say, oh, it's 2 hours have gone by, or maybe 6. You need a chest x-ray, and then we wait again for that. So trying to expedite processes, which I think AI can help with, it's coming.
Thanks, Tony. Appreciate it. 902-405-6000, 1-877-801-8255. We're going to stop for the news. Dr. John will be here on the other side. If you have a question, a couple of lines are open. 902-405-6000, 1-877-801-8255. We're back after the update. Welcome back. This is House Calls. He is Dr. John Gillis, and he's here for the next 15 minutes to answer your medical-related questions. We're going to cut the segment just a little short this week because we've had a Bank of Canada announcement today, and we're going to try and connect up with our mortgage guru, that being Clinton Wilkins, who's going to give us his thoughts on the announcement today. The Bank of Canada was going to hold its key overnight rates, not moving it up, not moving it down, and keeping it just right, as the old porridge saying goes. 902-405-6000, 1-877-801-8255. Dr. John, let's welcome Eric to the show. Eric, how are you?
I'm good, Dan. Good to hear you back again.
Thank you, sir.
Dr. John, my question for you is there a gold standard for blood pressure? I know that when you're in your 20s, your blood pressure is lower than it is when you're like me, almost 80 years old. So is there a safe standard for older people that could be elevated higher than what it was when you're in your 20s?
Yeah, I mean, the benchmark we still use is around 120 on 80. We do see a small creep as people age and, maybe are willing to accept, slightly higher readings, as time passes. We sometimes see the top number up a bit more than the bottom number, what we call elevated systolic hypertension. But the benchmark, really hasn't changed. We see people typically above 130 consistently. We want to treat them. If they're higher than that, it becomes more urgent. And assessing, what the issue is. I mean, is it, it's sometimes dietary. Most of the time it's not. It's just the way people are wired and needs to be addressed. There are some people that, just live on salt and caffeine and make changes to their diet. Their blood pressure is down. But for a lot of people, no matter what they do, their blood pressure stays up and needs to be treated. So those are the benchmarks we follow. Not much has really changed. There have been a few subtle tweaks over the years, but the standard is still the same.
You're saying around sometimes if you're older and it's up like around 132, that's not really a concern because later on in the day it might go back down to 125 or 122, and you shouldn't have any concern about having that rock thrown against the glass proverbially, I guess.
Yeah, look, I think that's fair. And one of these standards is you don't just treat one reading. You take 3 to 5. If somebody comes in to see you and they're a Leafs fan and they're pissed off because the Leafs gave up a touchdown last night, the blood pressure's up a little bit. You do it, you get them to take it at home and they tell you, they take it twice a week in the morning and it's normal. So you factor in all those things, situations, and multiple readings. If somebody shows up at, the Emerge and is 220, we're treating them. We're not waiting for 5 readings. But, if I see you and you're 135, you're feeling well, that's something we would track over time and probably get you to check your readings either at home or maybe at a pharmacy, at a time when you're relaxed or calm. So that's the approach.
Thanks, Eric. I appreciate it. Good luck. 902-405-6000, 1-877-801-8255. Dr. John, these fitness trackers, these watches that monitor your heart rates, is that an accurate reading, or should we have like the legit thing over your arm and the little squeezer and all that stuff?
No, I think they're getting better and better. I think they give people a good sense of what's happening. We see people, I'd say fairly often these days, who show up at the Emerge because their monitor told them that they were having a high heart rate at some point. Sometimes they're aware of it, sometimes they're not. It can be a useful screening tool, and I think it's good to, in general, if people are aware of their health and their, fitness parameters. It's not always super accurate, and it's a piece of information among other pieces of information.
902-405-6000, 1-877-801-8255. Hello, Brian.
Good day, sir.
Your question, please.
I do have the bug that Dan and everybody has. It's been 3 days of coughing, hacking, and mucus. I'm just wondering at what point should I be thinking about bothering the healthcare system for antibiotics or so forth?
Well, if you have this virus that's gone around, antibiotics are really useful. But sometimes it's useful. But getting rid of the cough is a steroid puffer. So what happens is the virus irritates the lungs, and they stay inflamed and in spasms. So sometimes for symptom relief, that can be helpful. I usually, suggest 1 to 2 weeks before doing that. If you have a fever or you're struggling to breathe, that's different. Sometimes, I'd say fairly rarely, but the virus can turn into a bacterial pneumonia, from mucus sitting there, or sometimes it's started as a virus and got something else because you were exposed or unwell. If you're unwell past a week, particularly if you have a fever and having trouble breathing, you should get checked. If the symptoms are minor, kind of still a lingering cough, usually Usually they'll subside in 2 weeks, but again, a steroid puffer can be helpful. It's frustrating, obviously, to hang out and emerge for hours to be told you need a puffer. That frustrates people, or they're told they don't need anything. But some of these things can be handled a lot of them can be handled with your GP, a walk-in clinic, Maple, and in some cases, pharmacists prescribe some of these meds.
Best of luck, Brian. Hope you get better quicker than I did. It certainly held on for a long time. 902-405-6000, 1-877-801-8255. Let's see if we can squeeze another call in here. Tim, how are you?
Hey, guys. Good. Gave blood recently, and the technician said my iron level was 187. That's borderline high, she said. What is a good level for your iron levels?
It's a hard question for me to answer for you because there are actually several measures that we use for iron. There's a straight iron level. There's a ferritin, which is more common. There's iron binding capacity. So short answer is I'm not sure which one you're referring to. And often people will say an iron level when they're referring to a ferritin. Now, 187 for a ferritin, that the range is higher than that. Probably you're going to need someone to actually take a look at the blood work and say this is what the test was and here's what the range was. I wish I could tell you more than that.
Dr. John, how do you get too much iron in you? I've obviously iron deficiency is a thing around here, but how do you get too much?
You usually don't from diet. There's a condition called hemochromatosis where the body stores too much iron and can cause organ problems, liver problems, different problems, and something that we track. As I said, a ferritin is a common measure of iron, but your serum ferritin can also go up from inflammatory processes or alcohol. So, different things that make it everything in context, I guess, is the point. We'll see high ferritin readings, but we'll determine that it's from an inflammatory process or somebody is a bit of a drinker. True hemochromatosis is pretty rare, but it is something to keep an eye out for. Most people, just from eating, it'd be very rare to drive your iron up just from what you eat, drink, unless you were, taking obscene doses of supplements or iron-rich foods.
Let's get one more call in here before the break. Greg, how are you?
Hi, Dr. Gillis. I just wanted to say how much you're appreciated for all the volunteer time that you put in to answer all these medical questions.
Well, it's kind of you.
Thanks, Greg.
And the other thing I'd like to say, is I hope your daughter's doing well.
Yeah, she is. She recovered well, and again, we don't say it enough. She received excellent care from our initial assessment in Dartmouth to the team at the IWK, the surgery team, the nurses on the floor. Just phenomenal, and we're very lucky. And sometimes we forget to say thank you, and we really appreciate it, all the care.
Appreciate the call, Greg. And Dr. John, that's going to do it today. We'll give you 15 minutes back. Enjoy it, and we'll talk to you next week.
Sounds good. Talk soon.
That is Dr. John Gillis here every Wednesday to answer your medical-related questions. And we'll do it again on next Wednesday here from 11 until 12. We're going to stop, take a break on the other side of it. The Bank of Canada holding its key overnight interest rates. We'll get an analysis on why they made that decision and what that means for your mortgage and perhaps for you buying or a new home or refinancing with our mortgage guru from Mortgage 101. It's Clinton Wilkins, and he'll be our guest right after this. All right, welcome back. It is Wednesday. We're rolling along here on the broadcast. Glad you're able to spend a few minutes with us today. And I know many of you were watching the Bank of Canada today as they laid out their guidance for the next few months with regards to what's going to happen with the interest rate. And the Bank of Canada has decided to hold its key interest rate steady at 2.25%. And, of course, that doesn't really catch many people by surprise. It's what economists, and I think our next guest told us on the last edition of Mortgage 101, and that, of course, is our mortgage guru, and it's Clinton Wilkins. Clinton, how are you?
Thanks for having me, Dan. How's your day going?
Well, it's not too bad. It's at least I don't have to go home and shovel, right?
Yeah, this is true. I'm in Vancouver this week, actually, for our mortgage summit, and I avoided the weather, so I got out before this last dump of snow, which was great. But interestingly enough, one of the speakers at the summit yesterday was Stephen Pullis, the former governor of the Bank of Canada. So I certainly was able to hear his 2 cents worth on where things are going here with the Bank of Canada and what's going on in the economy.
I think the last time we talked, Clinton, you had suggested that you thought the Bank of Canada was going to hold this time around, and lo and behold, they did.
Yes, it was not a surprise for me, and the economists were projecting it. The thing is, Dan, the economists are all over the place. And the one thing that I really took home yesterday from the summit was expect the unexpected. And I know how maybe reality TV, that sounds, but we're almost in this reality TV environment now with what's going on in the economy, what's going on in the U.S., trade, inflation, and GDP. The one word that kept on coming up was stagflation. We always talk about a recession and, what does a recession look like? Are we in a recession? Is the economy softening? But they kept on using this word stagflation, and that might be the theme here for the next couple of months.
So now that Tiff Macklem has made this pronouncement that they're going to hold their key interest rate at 2.25, what does that mean for people that are holding a mortgage?
Well, their cost of borrowing is going to be stable. And, I don't think the cost of borrowing is the issue here, Dan. I think we're in a better place than we were, 2 years ago. Sure, would I love people to have all their interest rates start with a 3 or start with a 2? Yeah, that would be great. But we're not in a rate environment that is going to stimulate or suppress, I think, what's going on right now. By and large, Canadians can afford their cost of borrowing. We're certainly doing a lot of mortgages. Last year was our best year ever. In terms of transaction count, we're kind of in this stable place. And I think being in a place where it is a plateau, consumers can start making some decisions on, if they're going to buy another property, if they're going to refinance, their mortgage coming up for renewal. They can plan on, where things are going. Again, things can change tomorrow, as we know, with the relationships, even with the U.S., things that are certainly volatile. But I think being in a more plateau situation can give some people ease and know, really what to expect at least the next little period of time. The one thing I will say is more and more consumers are choosing to take a variable rate again, Dan, primarily because most variable rate mortgages are at a lower borrowing cost than a fixed. I think by and large, Canadians overall feel that, if we do go into a recession type situation, the Bank of Canada will lower the key overnight rate and the cost of borrowing will become less. Obviously, there are some big pros with a variable rate mortgage. You can always convert it into a fixed rate if you need. And if you do need to break that mortgage early, it would be a cost of only 3 months interest to get out. So certainly pros and cons. I think everybody's situation is different. But I think being in a plateau overall, I think is a little bit easier to plan than, a more volatile rate environment.
As part of the announcement, the Bank of Canada said that they expect the economy stalled in the last quarter last year, but are also expecting to recover over the next couple of years. Those that are maybe looking to refinance their mortgage, those that are looking to perhaps get into the housing market, what are you expecting for the next quarter and the remainder of 26?
I'm watching the job numbers. I'm watching GDP and I'm watching inflation. Those are the things that I'm really watching. For me, I love a variable rate mortgage. I'm in the mortgage business. I'm watching it every day. Not every consumer has us to give them the advice, watch it and tell them if they need to do something different. I can tell you that a lot of consumers are choosing to do that variable just because, we feel the rates will be less. The one thing that we even talked about last year on our show, Dan, the best time to do a transaction oftentimes is yesterday. The people that are coming up for renewal, we see a lot of folks these days that we did mortgages for 3 years and 5 years ago, and they're coming out of either higher or lower interest rates into a different, rate environment than that they were used to. I think it's so important when you're doing a transaction to seek the advice of an unbiased mortgage professional. Not every mortgage is the same, and just don't renew with your existing lender. I think it's a good time to look at your finances. We're still talking about Mary Detmus, Dan. I know that was our show this month, but it's a great time to take control of your personal finances. And, we've got through the holidays. We're almost through January. Spring is going to be around the corner. But 2026 is a great time to, really focus on financial health and wellness. And obviously, mortgage lending is a big piece of that for people that own a home or want to own a home in the future.
Clinton was off for the last couple of weeks and had an opportunity to get out and wander around HRM and take a look around and saw a good, I guess, a healthy number of for sale signs on people's yards. What's the market like right now, and what do you expect that to be moving into the summer?
Well, if we're talking about all of Canada, there certainly has been a softening. I think prices overall are down about 20%. That's not the story in Halifax, and it's not the story in Nova Scotia. Our prices are up somewhere about 3%, Dan. That is, we can deal with it. We have more demand here than we have supply, but there's certainly more supply coming on hand. I'm cautiously optimistic. I think it's going to be a great year in real estate, in mortgage finance. Certainly the demand is very high. And, I think there were some buyers the last couple of years that were sitting on the fence because A, there was no supply, but B, with the rates being high, just the optics sometimes of a transaction didn't make sense for folks. This year, where rates being more stable, more inventory, I think we're going to see a lot of activity in the real estate market. And I think we're going to see more listings going in to March. Typically, we see a big uptick when we talk like week 3, week 4 March. That's when we start seeing a lot of, traction in the marketplace.
What are you expecting the prices to do? Are we going to hold steady? Are we going to decrease? Are we increasing?
I think we're going to hold steady, and if anything, we might continue to see some price growth. We can handle a 1%, 2%, 3% growth. We are a bit of an anomaly compared to the rest of Canada, and that's okay. I think Halifax, Nova Scotia, Atlantic Canada is a great place to live and a great place to do business, but we do need more housing. I think the more housing that we can start, with all types, including rental, it's going to help restabilize the marketplace. And, you know what they say, the real estate market is just like every other market. It's a game of supply and demand.
Clinton, as always, my pleasure.
Thanks for having me, Dan. Have a great day.
That is our mortgage guru, Clinton Wilkins. You can log on to his websites and clintonwilkins.ca, and there's all kinds of information about rates and what they mean and variables and fixed and what's better for you. And if you're getting ready to redo your mortgage, or you're looking maybe to refinance, or looking to get some equity out of your house and out of your property, lots of information available there from Clinton. And of course, you can catch Clinton right here on this radio station every month on 95.7 News Radio with Mortgage 101. And the Mary Detmus episode is up, along with all of Clinton's other episodes, on our website, halifax.citynews.ca. Very quickly, before we head off into the update here at the top of the hour, Halifax Regional Municipality advising residents that the enforcement of the overnight winter parking ban has now been lifted. Yay! The winter parking ban, of course, for those of you that are new to this, is in effect from now until March 31st. And regardless of the status of overnight winter parking bans, whether you have received a notification, vehicles can be towed anytime during the day and night of the year if they're interfering with snow clearing operations as per the Nova Scotia Motor Vehicle Act. So the winter parking ban, the overnight winter parking ban has been lifted. Park as you will. We're going to get an update on the news at noon, and on the other side of it, hour number 3 of the program today is the open hour. Lots of debate at City Hall yesterday on bike lanes. We've got some clips from councillors and from the mayor, and I'm interested in your thoughts as this is far from over, folks. The debate rages on over bike lanes and HRM. That, or whatever you want to talk about. That's the beauty of the open hour, and I'm looking forward to hearing from you after the update. All All right, welcome back, and welcome to the open hour. The telephone line, folks, is now open, 902-405-6000, 1-877-780-1825. Your chance to talk about whatever it is on your mind. Regular rules apply. You can bring something we've talked about, something we haven't talked about, something you want to raise some awareness on to the table. Again, 902-405-6000, 1-877-780-1825. This article from our website, and it reads, Halifax councillors spend more than 2 hours talking about bike lanes Tuesday afternoon amid a ballooning price tag for the municipality's bike network. A staff report identified 3 projects that could adjust to find some savings while still keeping all ages and abilities. That's that AAA standard for the overall bike lane network. If council decided to move forward with the cheaper options, it would mean a savings of about $4.5 million on the overall price tag of the network, which staff say is now expected to ring in at $85 million. Councillors voted in favor of initiating functional design planning for staff's cheaper designs for Novalee Drive and Wellsford Street on the peninsula, but chose to stick with the original design for Highfield Park Drive. The skyrocketing cost of the AAA bike network, originally expected to cost about $25 million back in 2017, was a point of debate at council yesterday. And as you can imagine, councillors lined up on both sides of the issue. Mayor of Halifax, Andy Fillmore, is maybe a little concerned that we didn't look deep enough at this bike network.
So I would say, given the scale of this increase, which if we put it in percentages, it's in the ballpark of 360% increase overall and about 1,000% increase for HRM's share. It would only be responsible for us to examine lower cost alternatives, including options that fall outside or below the AAA standard.
District 5 councillor who has been in support of bike lanes pretty much for the entire time that he's been sitting at the council table is Sam Austin, and maybe showing a little frustration.
This is about providing for people, and it is more expensive, but so is everything we do. And yet we don't put the road budget to the same scrutiny.
That's just some of the debate that we saw yesterday around the council table with regards to this this ongoing debate. Now, after the council meeting ended yesterday, Mayor Fillmore put out a statement who said he is now advocating that city staff go back again and look at some of these costs that are associated with this AAA network and come back to council with some options to reduce the cost, even if it means moving from this AAA network to something that's not the gold-plated standard. All of this as the budget discussion began last night, and very quickly before we go to the phones, I know there's a number of you on hold already. I watched the budget meeting last night. It started after 6. Now, I will put a caveat on it. I did not see it all, but I saw 40 minutes, 45 minutes at least of it before I switched over and watched curling. That being said, if you would have just tuned into that meeting, the budget presentation, with the public, this was all about the public. This was people that wanted to speak to council before their deliberations began. So it was all public participation. And we saw people who were opposed to the widening of Roby Street. We saw people who were cyclists that were advocating to complete the bike network. We saw and heard from people who think that City Council should keep the entire funding model in place for Halifax, and so on and so forth. So if you would have just tuned into that, you would have been under a rock and had not been listening to this show and others about bike lanes and about Halifax and about the rapid transit plan. That's the only thing you would have heard. I was kind of shocked, given the number of calls and the number of open lines that we've dedicated to these subjects here over the last years. I think it goes back as far as Rick Howe. And not a single person opposed to the bike lanes, opposed to Halifax, took the time out to stand up before council and share their thoughts and their case on that. It was kind of surprising to me. Now, the city put out a release today saying that these sessions are open to the public and you can certainly participate. And I encourage you, whatever side of the issue you're in or on, to do so. But it was certainly is one-sided the right way to describe it last night, with advocates and making very strong cases, I might add, for the reason why they think that the bike lane network needs to be completed no matter the cost, or that we shouldn't be widening Roby Street. The Friends of the Common were there, as were others. And that we should not adjust the funding model at all for the city's environmental program called Halifax. Just not what I've been hearing here on this program. 902-405-6000, 1-877-801-8255. We begin with David this morning. David, how are you?
Great. Good morning. Welcome back.
Thank you.
Just going to maybe play a little devil's advocate with you this morning. I don't know if you're a fan of the snow removal. I'm not, but I just find it unbelievable that the city shuts down for a snowfall. I guess we make fun of Toronto calling in the Army. What are we going to do, call in the Army too? If you look at the totals from Enviro Canada this morning, Bedford Peninsula had 20.8 centimeters, Dartmouth 26, Fall River 22, Hammonds Plains 24. I'm just reading right off their website.
Yep.
And we shut our city down for 2 days and our schools. So what does that tell you, Dan? Does a red flag come up that we don't have the resources? Does a red flag come up that we are too big for our breaches? That we've got grown over the last 2 years? We've had no snow, a few snowstorms here and there. Are we going to be in a mess? Are we going to be in this situation? That's 20 centimeters of snow, Dan, and the peninsula, and we shut the city down.
Yeah. I can't argue with you, David. I really can. And I can tell you that last year, sorry to cut you off, but last year I flew into Northern Ontario, and when I left here, they were warning of a 30-centimeter storm, and I'm like, oh, my goodness, am I going to be able to get in there, or is it going to be shut down? And I landed, and school was on, and the buses were running.
Yeah, the reason I was saying playing devil's advocate with you is I don't know if you're on the side of good service they're doing. I know your radio station. I know yourself saying about the plows going by and the streets down the pavement. But are we? I think the city, the whole HRM, the part of that looks after what we pay for as taxes for services, have stretched everything, like 48 hours for a sidewalk, 36 hours for side roads. Like, this is getting crazy, Dan. And we're expanding subdivisions. We're expanding our houses. We're expanding, from Halifax all the way to Bedford down what I call the Carney Lake Road, not Larry Utech Boulevard. But anyway, that being said, where are we going to be next year? Like, I'm looking out my window, and the snowplow for the sidewalk, it's not a bus route, but has just gone by. It's Wednesday morning, Dan.
I hear you.
And what about accessibility people in wheelchairs?
Exactly.
Elderly people. Like I think it's time, maybe a show where I know Rick did it once, where somebody's on here saying, okay, like how much do we have to put up with this? Like maybe someone from I remember he had someone on from the department of the maintenance department, whatever, for snow removal, and they had all these big, they went around saying, or we're going to take the sidewalks back because you can't look after them. So people were complaining about not having their sidewalks done. So, we're going to do the peninsula now. They're still not doing the job. You might as well shovel them yourself. I guess what I'm trying to say this morning is that this was really pathetic. This was really bad. This doesn't look good for the city to shut down schools for 2 days. Do you know how much money that costs people? Do you know they have to scramble to go to the office, scramble to find out what they're going to do with the kids? With the school is shut down for a second day because the roads, their excuse was the roads weren't safe and the parking lots weren't done. That is giving up. That is saying that we do not have the resources, and you know what? You're going to pay for it. So we're paying for it. So it costs us money to find a different avenue to take our kids to. It's going to take us longer to get to work now because we got to take the kids somewhere else, so on and so forth. So how much money is this costing? And you know what? The counselors, the people around there that make all these decisions, put this out for tender or whatever, maybe our resources aren't there. Maybe our resources are just not there, that we need help. We need to find a better structured way to do this, because I really feel bad for the senior citizens and the people that need the access, and it must be terrible on them.
David, great call. I can't argue any of your points.
Thank you very much. Have a great day, buddy.
Take care. 902-405-6000, 1-877-801-8255. Do we forget? Do we forget how to do it? Because, let's be honest, last year we didn't have any snow. And if memory serves me, very little the year before. Do we forget? Do we get new contractors in every year who have to relearn how to do all of this stuff? Should this be taken away and brought back under the umbrella of the city? Used to be the city that moved the snow, right? All valid questions. We're back after the break. Welcome back. The Open Hour continues. A few lines open if you'd like to get into the conversation. 902-405-6000 or 1-877-801-8255. Let's go back to the phones and welcome Mike to the show. Mike, how are you?
Good, thank you, sir.
It's on your mind.
I'm the one calling from Manitoba, Canada, Manitoba. And we still got snow in here. Cold, excuse me, now it's cold. It's been, but I just like to thank everybody in Newfoundland, Nova Scotia, New Brunswick, PEI, and Ontario and Quebec. All these people have been putting these hours in to do the snow removal. You know, I know people complain they're not doing their job right, but those people got a lot of work doing. They put a lot of hours, and I just want to call them and say thank these people for doing it.
All right. Thanks, Mike.
You're welcome.
902-405-6000, 1-877-801-8255. I truly don't believe that it's the people on the ground that are responsible for the length of time it takes to clear snow. I really don't. I think they're doing. In fact, I know that they work lots of hours. I get up at 4 a.m. I see the snow plows out. I see the sidewalk plows out. I just think that systemic issues here. I think that the system doesn't work. Nobody's going to criticize the person on the plow. I just think that the city needs a better way to move snow. And if, you know, these are the new realities, are we going to get, we're looking at another dump of snow on Sunday. What's going to happen then? Welcome, Alex, to the show. Alex, how are you?
I'm doing good, Dan. How's it going?
Good. What's on your mind?
Yeah, I guess just a quick comment that I feel like relates to so many of these municipal issues that come up all the time, including snow removal. Yeah, it may be a systemic issue, but I mean, I think in terms of most services, what's needed is extra money. We get more money, we get more people out there in plows. We're willing to, have bigger contracts that allow these third parties to hire more staff, or we have something internal in Halifax with, some people on staff with the city that plow. I think there are solutions there, but the problem is adequate funding, like it is with so many things. But my question on that, and also relates to sort of any time I hear a counselor on your show talking about, well, with inflation, our taxes, our fees need to go up, we need to make cuts, we need to reduce services because this inflation affects us all. But the one thing that I don't seem to hear in that conversation is I mean, Dan, where does the municipal government get their revenue from? You and me. From you and me, but specifically, what tax is pulling that in?
Property tax.
Property tax. What of all the inflation you can think of since the start of COVID in 2020, what cost has gone up more than anything else for everybody in this city?
Property value.
It's
Absolutely.
housing.
Right.
Housing has exploded. These property values have doubled over the last just handful of years. So to me, that means, yes, their tax revenues have doubled also. And I'm sure there's lots of inflation and some of their costs are increasing. but not at the rate that housing is increasing. So the idea that we have had any sort of backward steps in any municipal services over the last 5 years, it just seems criminal to me. These people are pulling in more revenue than they ever have before. That has to be part of the consideration in some of these issues. And where is all that money going?
Great questions. Absolutely.
Thanks,
great
Dan.
questions. Have a good one.
That's all I got.
Cheers. 902-405-6000, 1-877-801-8255. It's, I've talked about this during the budgeting process. We know that we're still staring at 10.9%. We know that people are waiting on the data from on the property assessments. But to our last caller's point, property values have gone up significantly over the last 5, 6, 7 years, right? So that means that we have the ability to generate revenue from property tax has gone up, and I realize that councils of yore have been doing what they can to keep the tax rate even, and now we're paying the piper. One of the presentations that I saw last night before the budget committee, one of the public presentations I saw last night was somebody that was advocating for the Central Library. And if you remember back last year, council, I think it was $10 million, dipped into the reserve funds for the Central Library in order to lower taxes. And you say, well, that's good. And that way I'm not paying as much taxes. But the person that was speaking last night went on to say that they're seeing now out of order messages on things like printers, public printers, and elevators that have had problems, and was wondering if that budget cut led to some of the services that people have been accustomed to using at the Central Library have been pushed to the back burner because of those budget cuts, because the city or the council, for lack of a better term, robbed that money from the Central Library's reserve fund to put it into general revenue so that they could put out a headline saying that the tax rate's lower than they had anticipated. We've been kicking the can down the road for years, and now we can't kick it anymore. And if you read the budget documents and the projections, obviously we're going to see a reduction from the 10.9%. That's how the budget process works. But we're going to see, I'm going to suggest 5, 6, maybe 7% increase in taxes this year. The forecasts are for 8 or 9% next year. And then the following 2 years, back to the double digits, I think it's 11. So this is just the beginning of the cliff, folks. And if yesterday's debate, and I know I'm going back to bike lanes, and I know that a lot of you get upset when we do this, but if yesterday's debate on bike lanes is any indication, city staff came back with a cost-saving measure for Highfield Park. And council said no. Just let that one sit for a minute while we take our next break. Open Hour continues on the other side of the news. If you want to get into the conversation, the telephone number is 902-405-6000, 1-877-801-8255. Your calls when we come back. Welcome back. This is the Open Hour, your chance to chat about whatever it is on your mind. The telephone lines are open. There are several lines available if you want to get on. 902-405-6000, 1-877-801-8255. Back to the phones, and we say hello to Nicole. Nicole, how are you?
I'm well, Dan. How are you?
I'm good. What's on your mind today?
Oh, my goodness. There's a lot going on here right now.
There is.
And I love that you keep saying that it's systemic, and it is. And when we're looking at the budget issues and when we're looking at the Auditor General report, what we seem to be feeling, I think, as the public are the effects of bureaucratic and legal administration and not what we think or assume is democracy. And so when we're looking at the budgets, I'm incredibly curious to know how much the HRM is spending every year in lawsuits. I think if the Shuby Park issue has showed us anything, it's that the lawsuits appear so voluminous right now that council had to find out that a lawsuit was filed against one of the largest parks in the city on your show in December, even though the suit was filed back in July. But then the bigger question is, why are these lawsuits being filed? And how many? And across how many sectors, and why? And so I've been looking at this for over the last 6 years, and I've been digging, and I've been corresponding, and I've been collecting information. And what I have observed is a reoccurring pattern in how the legal functions within public institutions are being carried out. So across municipal government, oversight offices, statutory boards, and health systems, the same interpretive posture is what's shaping the decision making. And the pattern involves either an elected official, in the example of council, kicking every question to the solicitor or shoving it off to administration, or when you get into hospital systems or the education system, you're met with unelected, appointed bureaucrats that are in positions of authority and power inside of these public institutions. But what's happening is every time a situation hits them that they either go, uh-oh, we're in trouble, or I don't want to deal with it, it ends up getting pushed into these legal and insurance channels. And what happens when it hits legal is typically they start to narrow statutory pathways that should remain accessible to the public by saying this applies, but this doesn't apply, but this applies, but that doesn't apply, because they're narrowing their interpretation of what they're looking at. And then they decline to even go into oversight mechanisms where the mandates are very clear, choosing legal process instead. They'll deflect jurisdiction in situations that warrant their engagement. So they'll say, that's not my responsibility, it's this department, when ultimately it is their responsibility. And then they treat matters that have public interest implications, especially public safety and public trust, as if they're administratively optional for them to look at. And in several instances concerning safety or accountability, my inquiries have been met strictly with legal positioning that is only there to insulate the institution and has nothing to do with transparency or review. And what I found is that even though these institutions are operating independently, the legal behaviors that they're producing is strikingly consistent. And that consistency is what signals for me a serious systemic issue in how lawyers are operating in public sector legal spaces. So the legal advice being provided within these public institutions influence the decisions that are being carried out in these spaces, and it also affects Nova Scotians' access to justice. It affects our ability to participate in statutory process. It also changes what our expectations are of meaningful oversight. And so when we start to see these patterns surface across unrelated bodies, that shows that this isn't just isolated in certain areas, but it's a broader question about how public sector legal work is actually functioning. So if I go to the hospital and something happens to me there, you're told, if you have an issue with the hospital, that you file a complaint through their feedback system. What they don't tell you is that feedback system is protected by the Quality Improvement Information Protection Act. It's called QIIPA. So the moment you actually report something there, it becomes an internal confidential record. And they're then under no obligation to actually get back to you, and it turns into a risk management profile on your account. And what happens is, unless you can chase it down and you know exactly who to find inside the hospitals, your file, if they deem it risky enough based on their internal investigations, they flip it off to the insurer and the insurer's legal team. And once they do that, the hospital is therefore legally not obligated or allowed to speak to you anymore. So if there's a lot of people out there trying to figure out why things are happening in the hospital and they can't get a call back or they can't get a response and they've filled out the feedback form, that's why. And then when you chase it down to the lawyer, you find out that the lawyer that represents the hospital is also the same lawyer that represents the insurance company. And then you hit a stalemate. And in every instance I've found with every institution I've gone up against, and I've made it to the legal process, I'm shut down by lawyers and told to lawyer up. So, what does that mean at the end of the day when we're looking at our budgets? Are all of the money that should be going into public resources
going to lawyers,
actually going to lawyers? And I think it's yes. And when I look at the issue with the hospital, my first thought is if you're representing both the insurer and the hospital, that's two separate matters. That's two separate clients. Are you double billing the system?
Sounds like it.
Every time I talk to you? I don't know, because I can't get a clear answer because the lawyers and the bureaucrats are not required to respond, but the lawyers should be there for the public service, and they're not. They're there for institutional protection and risk mitigation. And once you're in that legal and insurance channel, if you do not have the ability to lawyer up, your conversations are effectively stalled. So even as the media is asking questions and we're trying to dig into what's happening, we're usually not talking to elected officials. We're usually talking to appointed bureaucrats, and they are operating inside of these legal and insurance frameworks. And so my question specifically to the Auditor General, because I went through her report because I've been looking at it against a case that I'm involved in, and there's nothing there about legal fees. We have no idea what the hospitals are paying in legal fees right now. We have no idea what the municipality is paying in legal fees, and something tells me that is not a minor line item on the budgets.
Fascinating stuff,
right
Nicole.
Yeah. Appreciate
it.
Thanks, Dan.
Have a good one. 902-405-6000, 1-877-801-8255. It's a question that I've asked in the past, and not necessarily in the legal realm, but in the staff report realm. Now, I know that the city employs staff. I know that they have departments and they have people that when staff reports come down, they have them go out and do their due diligence and bring back. That's the bike lane report yesterday was a prime example of that. But there has to be a cost that's associated with that, right? Because when somebody is tasked to do one thing, they're unable to do another. And I don't know how you put a dollar figure on that. But using the bike lane report as an example, Tony Mancini asked the staff to go back and find some cost savings on if they on the bike lanes. And the report came back with cost savings, but didn't look at anything but AAA because they weren't specifically told to look outside of that. So now the mayor's advocating for another staff. Do you see where I'm going here? It seems that we defer, at least at the municipal level, defer immediately to a staff report, and I get it. You try and make a decision based on the most up-to-date and thorough information that you can get, and that's your mechanism to do so. But there has to be a cost associated with that. And it feels like, folks, we staff report things to death. And then come back to council, and either they go with the report or they don't. So if they refuse it, which I think the Dartmouth Cove example is a good example of that. City staff made a recommendation. Council said no. All of that work and the costs for naught. We're back after the break. A few minutes left in the open hour. The telephone line's still open, 902-405-6000, 1-877-801-8255. If you want to try and squeeze in here before our time runs out at the top of the clock, by all means do so. Again, that number is 902-405-6000 or 1-877-801-8255. Hello, Chris.
Good afternoon, Dan. How are you doing?
I am well. What's on your mind today?
I heard you were sick a couple of weeks ago. I hope you're feeling much better.
It's lingering, but it's getting there.
It's getting there. Well, you're not drinking enough bourbon.
I can't get bourbon. It's American.
Oh, you come down to my house, I can get you some.
Fair enough. It's on your mind.
Look, well, the budget.
Right.
I mean, the easiest thing to do to reduce the budget the most is, and if the councillors are listening, put your ear to the phone, to the radio, and listen to this. Stop spending money on unnecessary projects. According to the information you divulged yesterday, the total bike lane to complete it to this standard that they've started is $151 million.
No, that's the 85 is the number, the total.
Okay, the way it came across on the radio yesterday, it sounded like 85 had already been spent, but only 59% is done.
They have 59% done, and that I'm just going to go through my notes here real quick. 59% done, and that cost there's still $66 million to go, and the total cost overall is $85 million.
Okay, I misunderstood what you were talking about.
Okay.
Anyway, $85 million.
Yep.
Well, that's still a substantial amount of money.
It is.
200 or more million for the widening of Roby Street.
Correct.
That's 850 meters, approximately half a kilometer.
Yep.
Just for comparison, the cost to twin a highway, like the 103, 102, and so on, the cost in 2025 per kilometer is between 5 and 10 million. Do the comparison. Where the hell are they spending 200 or 220 odd million dollars for half a kilometer? I realize they got to expropriate a few houses along there, but that doesn't equate. That just doesn't make the difference. The forum right now, word has it that the estimate has increased to do the forum project from anywhere between 150 and 180 million dollars.
Hadn't heard that number, but that doesn't surprise me.
Yeah, I heard it. I was told it by someone that I believe. 150 to 200 million on the Windsor Street Exchange. It'll probably be 200 million or more by the time it's done. And then talk of a stadium. Don't even talk about a stadium, guys. Electric buses. They've got a few right now, but if they want to fully electrify the fleet, it'll be a cost of another 500 million to $750 million with infrastructure. Now, there's a whole bunch of big-ticket items there that we aren't even facing yet in this budget, okay? And if people think this is bad, wait till a couple of years down the road. Also, they've got too many staff. My sources have told me that they have about 25 lawyers full-time on staff, plus they subcontract out legal work. London, Ontario has a population of 625,000 people, approximately. That's more than Halifax. But yet they have 1,000 fewer employees on staff. How can they do it and we can't? I mean, I just don't get this. The staffing is, I think they have redundancy. I think they've got a lot of fat that could be trimmed, especially not so much the boots on the ground guys, but the staffing that's in offices, in middle management and upper management, this sort of thing. They probably have too many managers and too many levels of management and executives throughout this organization. Something's got to give. There's another way that they could look at things. Start looking at some of the assessments. I looked up one apartment building. It sold in 2024 for $12,223,000. Guess what the assessment is? $2.9 million, and it's been that way for a number of years and has not gone up. Explain that one to me.
That's interesting, isn't it?
Yeah, well, it is interesting, Dan, and I'll tell you, it's this. You can fact check it all you want. I can give you I'm not going to give the address over the phone.
Sure.
But so that's a difference of around $9 million in potential assessment that could be taxed, generating revenue, and it's not. And I'm sure the list goes on, and I, for one, am going to be digging into this a little bit more and find out, for example, these new apartment buildings, when they come on stream, what is their assessment like? Is their assessment what the building permit says it costs to build them? Well, maybe it is, maybe it isn't. But income-producing properties generally don't sell for the cost to rebuild. They sell for a times revenue. How much revenue can they generate? Right. So I don't think that there's a lot of the bigger buildings, and not to target all the big buildings as being, or landlords as getting away with murder, because I'm sure they're not. But these sort of things have to be looked at. Instead of trying to always put it on the homeowner, look at some of the other big assessed properties and see if you're actually up to snuff on that. And that's property valuation service. The city could put pressure on them. The city could certainly put pressure on Tim Houston's government to put pressure on PBC. Anyway, look, it goes on and on. I could spend an hour with you talking, Dan, for that matter. But really, people, get out there, get to these meetings if you can. Talk to your counselor, because this 10 point whatever %, this is bad. If they get away with that this year, next year guaranteed it'll be more because they keep pushing it and pushing it and pushing
Right,
it
they keep
every year.
kicking
It
the can
gets
down the
worse
road.
and worse.
Yep.
Well, your comment about kicking the can down the road, I understand what that means or the way I interpret it, but I'd have to push back a little on that because over the last number of years, say the last 10 years, they haven't really been kicking the can down the road. They've been raising property taxes. And projects have been kicked down the road. Granted, I'll give you that, so maybe technically it is. But they've been doing a lot of unnecessary things the last 10 years or so. It's not just this council that's doing it. This council is bad. There's no question, in my opinion. But other councils have been equally as bad because they've been doing projects that are unnecessary and unwanted. That's the main thing. Unwanted projects. The majority of people that are paying taxes in the city are residents in the city. They don't want a lot of these projects. So, guys, stop spending the money unnecessarily. That'll get you a long ways.
Appreciate it, Chris.
Thank you, Dan.
And as I said earlier, folks, council they're politicians, right? They go with the way the winds are blowing for the most part. And I watched the budget meeting last night, and I watched the public presentations last night. Didn't see them all, but you get the gist. And if you were only going to make your decision based on the presentations that you saw last night from the public, bike lanes are a must. There is opposition, as Chris said, to the widening of Roby Street. We need the full 30%, whatever it is, funding for Halifax, and so on. So if you want to get involved in these process, the city put out another release today that all of these budget meetings are open to the public, and there's an opportunity for you to address council as part of these meetings. They list on their website, halifax.ca, how you do it, how you get your name on the list. You can do it in person. You can do it through Zoom. There was plenty of people that did it through Zoom yesterday, so you don't even have to leave your house. It's time that we as taxpayers become more active in our community. And if you like what they're doing, if you don't like what they're doing, you need to get involved in this process, because if you don't say anything, nothing's going to change. Last word today goes to Eric. Eric, how are you?
I'm good, Dan. Two very interesting callers you had on there for the last half hour. Very interesting to listen to. I've been listening to talk radio for about 30 years now, and I've always found it very informative. Invariably, every time there's a snowstorm, everybody's not happy about how quickly the streets. Yeah, you know what? There's hundreds of kilometers, if not thousands of kilometers of street and sidewalk. It takes time, right? And the thing is, I'm out at, like you, early in the morning, maybe not as early as you, but I'm out at 5 o'clock driving the streets to get my daughter to work until she gets a car. She works as a nurse over in the QE2. Mm-hmm. Last Monday, the first storm when you were away, was wet, heavy snow.
Yep.
The driving was treacherous. Monday morning, on this last episode, the streets were great. Like, you came from Northern Ontario. I lived in Ottawa and went to school there for a while. And when the snow becomes compressed and hard and it's very cold, it's relatively easy to drive on. Yesterday morning, the roads were bad.
They were slippery.
Now,
they were, that's for sure.
So here's my point. I can go into a big thing, but here's my point. All it takes is for one school bus to have a bad accident, and you have hundreds, 50 or 60, whatever the buses carry, of children, right? It's difficult for people, with your children and getting to work and stuff like that. But we need, in my view, we need some maturity. The employers should understand the situation. We're not in combat. We don't have to be someplace at 0800 when the storms don't allow us. So what I'm saying is, let's have some patience. I hope you agree with that.
I do, Eric. But it's the age-old question, right? People want their services on their street done now, right?
Yeah, exactly. And I'm just saying it's not feasible. So anyways, Dan, thank you very much for your time.
Copy that, Eric. Thank you.
Okay, bye-bye.
That's going to do it, folks, for this edition of the show. I hope that you had some fun like we did, and I appreciate you for dialing the numbers and joining the conversation. Again, I'm going to say it again. The budget meetings, they're all listed on the HRM website, or you can call 311. They'll sort you out and give you the information that you need if you don't have a computer. But if you don't get your message out to council, and I don't care what side of the issue you're on it, If you like them, if you don't, if they're doing the right thing, they're doing the wrong thing. If you don't get your voice heard and stand in front of the decision makers and make your points, then nothing is really going to change. If they took 25, 35 people every budget meeting that were opposed or in favor of a whatever, name the issue, politicians' job is to get reelected, and they will listen. I appreciate you calling into the program and sharing your thoughts. It's great. And we're certainly going to continue to offer that to you moving forward. It's a good way to stay in touch with what's going on in your community. But if you want to see a real change, then you have to get active and you have to get out and in front of this stuff. If you don't, we're going to get the same old, and more of the same. Thanks to Vanessa Veinotte on the other side of the glass for doing what she does. Outstanding work each and every day. Tomorrow, folks, a different open hour. Mayor Fillmore, Andy Fillmore, will be here from 11 until 12 to answer our questions, mine and yours. I hope you can join us. Until then, be kind to one another.